Okay, everyone, welcome. It's 10:30, and because we have a very packed agenda, we are going to start exactly on time. I know people are going to join in. We are expecting a lot more people, but just because we have a lot to cover, so we will start. I am Gunjan Veda. I am Senior Advisor with the Movement for Community-Led Development, and I will be facilitating today's session along with Nellie Mecklenburg from the Institute for State Effectiveness. We would have loved to do a round of introductions, but just because we are already 35 in the room and going up, we'll never get through our agenda if we do that. But we are going to request everybody to put in their names and organization names into the chat window. It's nice to know who we are sharing the space and ideas with, so please do that. Before we actually get to the purpose of this meeting, I quickly going to go through some ground rules and logistics. Like I said, we have a very packed agenda today, which means we are going to be strict on time. So if speakers, you've been given 3 minutes, you will be cut off at 3 minutes. Apologies in advance. We are not trying to be rude, but we need to get through everything that we do want to accomplish today. Again, because this is a meeting, not a webinar, because we want to hear from everybody, but there are already 44 people on the call. If all of us speak together, there'll be chaos, not to mention all the feedback and noise. So we have put everybody on mute, but if you look at the Zoom thing, then if you click on participants, you will see a raise hand button. Anytime you want to speak up, share a response, share a reaction, please click on that raise hand button. It's under the participants link. Similarly, you will see a chat icon, a blurb with 3 dots. Click on it. A lot of our conversation will be happening on chat in terms of people putting in ideas and responses. If you cannot find the raise hand button, that is where you go and say you want to speak up. My colleague, Anne Hendricks Jenkins, on the call is going to be monitoring the chat as well as the raised hands. So she will make sure that your voice is heard, that you get a chance to speak, or that your opinion is summarized and put in front of everybody here. So please use the chat button and use the raise hands button. When you do speak, please unmute yourselves first. So again, if you're new to Zoom, take a little bit of time to familiarize yourself with these 3 buttons: chat, raise hands, and mute. We will be using them extensively today. Please start with your name and organization name, and then mute yourselves when you have made your intervention. We will be recording, in fact, we are recording this session, and we will share the recording with everyone when this is done. We recognize that these are difficult times. We also recognize that technology can act up, and we are all coming in from different places. Technology is not most reliable, or connectivity in most of these places. So I ask that you be patient with each other and with us as we go through them. I'm sure there will be glitches that come up. So I ask for your patience. And most importantly, this is a brainstorm, which means that we are all here not just to take, but to give. And we need your brains here. So we are not looking for your intervention to provide us with that one solution that is going to solve all our programming challenges and problems. So we're not looking for the magic bullet here. No idea is wild. These are crazy times. We have crazy challenges, and that means we need crazy ideas to begin to solve them. So during the brainstorm, don't think about, is this practical? Is this, what am I even thinking? Nothing is too wild. Nothing is too impractical. Nothing is not allowed. So please share in the brainstorm whatever ideas that do come here. Quickly about the structure of today's meeting, we're going to start with a couple of polls. In fact, they will come up, the poll will come up on your screen in about 10 seconds or so, I think. Nellie already has them set up. And then Nellie is going to talk about the purpose of the meeting, and then we are going to move to challenges. We have 3 organizations who are very quickly going to share some of the programming challenges that they are facing. And then we move to barriers. All of you have received 4 of them in your agenda alongside the agenda sheet. We do breakout groups. We'll tell you more about them when we get there, but they'll be 30 minutes, each around 1 barrier. And then we reconvene, share what we've discussed in the breakout group, and brainstorm where do we want to go from here. So Nellie, if we can have the poll up, please.
Absolutely.
So let's just start with where are we all? So 10 seconds maybe to put in the answers, 10, 15 seconds, and then we will move. Thank you. Nelly, you want to move to the next question?
Yes, hopefully this works. Here's the second set of polling questions.
Thank you. So these are 3 questions. They will remain on the screen and you will be able to put in your answers. But in the meantime, Nelly is going to start with the purpose. And at the end of that, she will share the results of the poll. So Nelly, over to you.
Thank you very much, Gunjan, and also thank you to everybody who's joining us in, I'm sure, very busy schedules wherever you are potentially self-isolating. So we've heard a lot from other movement calls, on blog posts, within our own organizations about the many ways that communities and community-led development organizations have mobilized so quickly to respond to the COVID crisis itself. Communities and organizations are sharing accurate information, they're distributing soap and supplies, they're setting up hand washing stations, distributing food and cash relief. So many amazing innovations that are demonstrating why CLD is so important and so valuable. And in fact, we're collecting these innovations on a Google document. You can see the link on the screen that Gunjan is sharing so that we can share some of these stories amongst ourselves and with others. But today's call is really not about that, actually. Instead, today we want to focus on how we can keep doing the regular work, the regular programming of CLD, of facilitation and social mobilization and trainings, which are at the core of the work that us and our teams and the communities we work in do every day and all year long. This kind of programming tends to rely a lot on face-to-face meetings and bringing people together to meet. But with COVID-19, that is very different. In a lot of places, people aren't supposed to travel. They're supposed to maintain social distance. They're under a lockdown. They're also really worried about meeting face-to-face and are dealing with social and economic impacts of both the pandemic and the policies that are being put in place. At the same time as there are these restrictions, this regular work, which of facilitation and social mobilization and training, which builds solidarity in communities, it addresses poverty and hunger, this work is where communities are helping to give the poor and marginalized within their own communities voice, to have greater decision-making power. These are still very important. And in fact, they're really important to responding to COVID-19. So today the goal is to better understand what some of these challenges are that we're facing in our regular programming, and then to brainstorm how we can adapt our programming so that we can continue with this work. Because we don't know how long COVID-19 is going to go on. In many countries, the impact of it hasn't fully emerged yet, and hopefully it never will. But in the meantime, it is in some places, it may come back in waves, and there may be restrictions and real fear about it for a long time until a vaccine is developed. And that could be a year or 18 months or even more. So we want to start thinking now about how we can adapt and resume our programming rather than lose the gains that the communities have worked really hard to make. And also being adaptable is so at the center of CLD programming. It's not just about COVID-19. Being able to respond to changing conditions in communities is at the center of our work. And that might be from disease, it might be from conflict or development or democratic crises, many things. So as Gunjan said today, we are not expecting to come up with solutions. Rather, we just want to start thinking together as a community about different ways that we can be adaptable and that we can apply these adaptations in our programming and what that means for the kind of work we do. So if we look at the polls, we can see that this has impacted a lot of the work that we do. 80% of respondents said that they've had to pause or alter their work due to coronavirus virus and social distancing norms. And 79% say that they have faced crises that limited mobility and convening before. So there's going to be a lot of ideas. Oh yeah, hi.
This is Anne. We're not seeing the polls on the screen. I don't know if you meant to show them.
Oh, thank you. Do you see them now? Oh, hold on 1 second.
Yes.
Okay, perfect. Thank you very much for pointing that out, Anne. So 79% have had to pause or alter their work due to social distancing norms. 79% have faced these crises or faced a crisis before that's limited mobility. So there's going to be a lot of good ideas about how we can respond and how we can do some of these adaptations. And then we'll also see that many of us rely on some of this work that happens in communities. So we really need to think about how we can keep going. Gunjan, do you mind moving to the next slide?
Sure.
So one thing that we want to start off with is with this question that's on the screen right now. What are some of the challenges that you're facing in your everyday regular programming as a result of COVID-19 or the policies that have been put in place, or because of concerns about the disease? So we'll give everyone a minute to just in the chat box to write a response. You may see the chat icon at the bottom of your screen, or if you see a more button, it might be there. So please go ahead and just take a minute and respond with some ideas of how this has affected your programming, what challenges and constraints it's caused. And then in about a minute, I'm going to ask 3 of the participants and our partners on the call to just speak to us very quickly about some of what they're facing.
Nelly, I had to take off the screen. Do you want to quickly repeat the question once?
Yes, definitely. So the question is, what are some of the challenges or constraints to your regular programming that different policies, concerns, or effects of COVID-19 are creating for you and your organizations and the communities that you work in? Why have you had to halt or pause your work? And Anne will help us speak to some of these, but I already see some really great answers, or difficult answers, but really specific answers coming up on the chat group. So thank you very much. And maybe while you guys are all thinking about that and responding in the chat box, I can turn it over to some of our partners. So the first person who I would love for us to hear from is Arthur Nkosi, who's from Core Africa, based in Malawi. Are you there, Arthur?
Yes, I'm
here. Hi there. Thank you so much. So thanks for speaking to us all. So if you could just speak for 3 minutes, as Gunjan said, I'm going to be quite strict, I'm sorry, on timing, and tell us about how this has impacted the work that Core Africa does, and if you've been able to start thinking about how to adapt in order to continue the programming, what are some of the ways that you've done that? And we'll have more time to discuss all of this in the breakout groups, so no worries.
Sure. Great, thank you very much, and pleasure to be here with everyone. Again, my name is Arthur Nkosi. I am the country director for Core Africa, Malawi. We are an institution that handles a lot of community-led projects done by volunteers that we take from universities, and we place them in rural areas, the most destitute areas of the countries. And we look at ways in which we can develop community-led programs that are run by the communities after the volunteers have completed their service. Our headquarters is in the US, and our founder, Liz Fanning, who has been able to create a wonderful program in 4 different countries, Morocco, Malawi, Senegal, and Rwanda. And one of the things that I'd like to share in this group to how do we ensure access to education for the youth, especially that are in the rural parts. I'm going to speak towards Malawi. Since we had the coronavirus come into Malawi, the first thing that the government did was to shut down a number of institutions, operations, one of them being education. We have a number of volunteers that are in different districts of Malawi that do volunteer at schools. One of the ways in which they integrate into the communities is by teaching at various levels. This could be a junior high school, this could be a nursery school. And because of the shutdown of the schools, many of the students had to go home without any information to take home. Now in Malawi, a lot of the privy people of the country are able to go on the internet. But one way that we are looking at developing this and seeing how we can approach it, just today I was call with the communications organizations, one of them called Telecom Networks Malawi, where they have now approved and agreed to set up a free Wi-Fi zone in different parts of the rural areas. This is for schools that have solar energy run computers to be able to download information and for teachers to continue teaching the students. However, the students will not be taught at the school. They will be taught in groups within their communities, and groups will be groups of 3, 4, 5. And Core Africa volunteers will be involved in this process to be able to gather that information and to help teach the students. Now, we won't be able to reach everybody in the country, but we are going to do as much as we can. Thank you very much. Let me stop there.
Amazing. And with 15 seconds to spare, thank you so much, Arthur.
Thank you.
Then I'm going to turn it over to Guillermo Sardi, who is with Caracas Mi Convive in Venezuela. Thank you, Guillermo.
Hi, how are you? My name is Guillermo Sardi. I'm here in representation of 3 sister organizations that operate in Venezuela: Caracas Mi Convive, Alimenta la Solidaridad and Sustento. The 3 organizations tackle different pressing necessities in a country amid a complex humanitarian emergency. Caracas Mi Convive focuses on urban violence, Alimenta la Solidaridad on food insecurity among children, and Sustento on integrating women to the workforce through social entrepreneurship. All 3 of them in the communities most hit by the crisis. The work of the 3 organizations connects with the other because we believe that tackling these necessities constitutes the means of our work and not the goal. Organization's goal is to strengthen a network of local leaders in such a way so that they have the necessary resources to find solutions to their problem. Since March, our work has changed dramatically to the quarantine. Social inequalities have deepened in my country. Staying at home is a privilege that few can afford. According to our latest survey, 90% of the residents of the most vulnerable communities in Caracas have violated the quarantine, even though state security forces and armed groups have tried to enforce it through fear. These groups have been persecuting people that cannot afford to cover their face with surgical masks, but the necessity to buy food is more pressing. Regarding our work, community kitchens are still in operation. Leaders have turned to social media to denounce publicly violent acts and human rights violation, and 3 women from the social entrepreneurship program began to sell homemade cakes and desserts in their neighborhoods to find extra income. When I was invited to participate in this meeting, I wanted to transmit some of the messages from our community leaders. I wanted to talk with 4, but one of them forgot to answer me because she was picking up donations for the kids who are beneficiaries of one of our community kitchens. I think her action was a sufficient response. Nonetheless, the other 3 told me that in this crisis, the most important thing about their work has not changed: building relationships of trust with their community. They have found ways to keep in touch through text messages and phone calls. Finally, I'd like to tell you about a conversation I had with Andrew, a 23-year-old young man from Katia, one of the most populous working class communities in Caracas. I said to him that community leaders were the key piece that kept this organization going. He answered me that something that I sincerely appreciate in these uncertain times, where I sometimes have found myself feeling that I'm not making any difference. He told me, also it is important to let people know that community leaders listen to people like you. I'm constantly learning from you, and that's something that can be left unseen. These crises have changed the way we work, but we value the responses our community leaders are having in this crisis. Thank you.
Thank you so much, Guillermo. And the last person we would love to hear from is Emma Akello from Spark Microgrants and based in Uganda. Are you there, Emma?
Hi, everyone. I'm here. And
Thank you so much.
thank you. Yes, I'm Emma Grace Akello. I work for Spark Microgrants. And Spark Microgrants is basically a systems change organization working in East Africa, in Uganda, Rwanda, Burundi, and also with some partners in Ghana and Congo. And our focus is mainly working with community partners and some partner organizations to empower local communities. And we do this through a seed grant. Since March, how Uganda has been affected and our program has been affected across East Africa. We've had some government restrictions that do not allow public gatherings and also lockdown in the country. And this has impacted a lot our project activities in the fields. So the communities cannot meet as required. We have a facilitative collective action process that requires communities to meet on a weekly basis, to plan for their projects, to do weekly savings activities, but this has not been possible. And as an organization, we've responded in quite a number of ways. So some of the immediate response strategies that we came up with is to suspend all organization travels. And also this means no field travels to visit our community partners, and also all community meetings suspended. And this means also our community projects were put on hold, and some of the strategies that we came up with and the strategy that we are trying to follow right now is to support the communities to come up with a preparedness plan. And we are doing this through supporting some government campaign processes like sending community SMSs to communities and also the community leaders, and also encouraging communities to come up with a preparedness plan. How we are doing this, because we cannot reach the communities ourselves, we are trying to use phone calls to talk to our community-based facilitators who then communicate to the community members themselves. And I think as an organization, this has also gotten us thinking to do some work around our systems gap, to come up with some systems that can help us remotely continue to support our community partners. Yeah, I think this is briefly what I can share about some of the things that we've done. And yeah, thank you.
Thank you so much, Emma. And thank you to all three of you for sharing and for being so concise with a lot of information. Gunjan, I will pass it over to you as I prepare the breakout groups. Right. And I'm going to stop sharing the poll results, but we can share all this information with everyone after the call.
Thank you, everyone. Thank you to the three speakers for sharing and being concise, and to everybody who put in stuff onto the chat. I know there was a lot of very interesting information and a lot of stuff there. We've tried to pull some of it. Anne is monitoring it, and we'll make sure that everything that was said there is covered. But before that, I want to start with when you received the agenda for this meeting, you would have seen 4 barriers that we sent out: access, convening, procurement, service delivery related issues, and finally time and shifting priorities. So we realize that this is not an exhaustive list, and as we are seeing from some of the responses that are coming on chat, there are other issues, but these seem to be the primary themes that emerged when we had a lot of preparatory conversations with movement members and when we attended some of the other calls on this issue. So in order to give some structure to the meeting and to make sure we are productive, we identified these 4 barriers and categories. Access, I think a lot of people have talked about it. The fact that we are not able to travel to our communities, to our programming countries. The fact that a lot of our communities do not have access to mobile phones or internet. Or how are we reaching the most vulnerable? And the most, how do we reach the most marginalized and the most vulnerable in the communities, because they really are the people who lack access most, right? So all those issues and challenges around access. Convening, One thing that a lot of you know about this research work that we've been doing for a year now, or collaborative research. And one of the things that has emerged is that most CLD programs rely on training, facilitation, community mobilization in some form or the other. What do we do about that in a time of social lockdown, social distancing, complete lockdowns, disinformation, misinformation, the fact that everybody from our own staff to community mobilizers to people in the community are afraid or are going to be afraid to convene and to meet for face-to-face interactions or group meetings. The third set of issues really around procurement and service delivery. Borders are closed. There are shortages of essential supplies. A lot of people in the chat actually talked about, not being able to get food or other equipment to the communities where they work and where it is important. Not knowing whether what we do counts as essential services, and so can our centers or our offices be open or not. All those sorts of issues. And finally, the fourth set around time and, shifting priorities. We haven't touched a lot about that in the chat, but this is an important segment, especially as we move forward, which is that a lot of our work relies on volunteering, right? Will people, as they take care of people who are sick, as they become caregivers, as they have to deal with their own livelihood priorities, will people have the time to engage? Our own staff, mobilizers, community members, again, applies at every level. So what I am going to do now is I am going to share my screen with you. And you will see what we've tried to do is that we have tried to capture some of these responses into the sheet where we are looking at 4 categories. And then of course I've put in an others category because there are certain things here which are not covered by these 4. But particularly if you are from the humanitarian field, you will see 3 words here which will be very familiar: preparatory, response, and recovery. This is because we recognize that not all of us are dealing and our communities are in the same space. In some places, we are at the peak. We have lockdowns, and so we are in the response phase. But there are still a few places, especially in Africa, where we are yet to reach this peak, where we know that lockdowns are happening, but they are only starting now and in urban areas. So we have that small window of preparation before it's going to happen. So what are the kind of challenges we are going to be facing there? And finally, the world, we don't know when the pandemic is going to end, but what we do know is that even when it does end, the world is going to look very different from what we know of it. We already know that domestic violence is up. We know of ethnic tensions and xenophobia happening in places. So social cohesion is at risk and under strain. We know a lot of people are going to move into poverty, are going to face hunger. And all of this is going to have an impact on our programming, as are the delays. There'll be cost-related and other issues. So when we look at the barriers and the challenges that we are facing, and we are going to take a few minutes now to kind of flesh these out a little more and to speak a little more about these. But as we do that, and I see somebody doodling on my screen. Okay, so as we do that, think about it through these 3 phases. Think about some of the challenges that are coming forward. And I will leave this on, but Anne, I am now going to move to you to either recognize people who have wanted to speak up and raise their hands, or to see if we have summarized everything. So just for that, we'll give it a few minutes and then we will head to the breakout rooms. Anne?
Hi, this is Ann Hendricks Jenkins. I am a advisor with the Movement for Community-Led Development. I don't see anyone's hand raised, so if I'm missing your raised hand, please just go ahead and unmute yourself and speak up. The key themes that have been coming out so far are that all the programs are on hold, shifting gears and delays. I mean, a lot of things are just suddenly frozen, and a lot of people that I've been talking to have been describing how that's really affecting financial issues as well, because if you're getting reimbursed for your program implementation and then you can't do it, it's a pretty drastic situation. Mobilization restrictions mean that both program countrywide programs, they can't reach their communities, and also communities are restricted from moving around themselves. Data collection is interrupted. That was both ongoing data collection, like evaluation data and other data, and then also data collection from what's going on in the in response to the crisis. Access to water, especially water for hand washing, issues of nutrition and food, especially where people are locked up. Getting up-to-date information on the unfolding situation in a country. It's, as we've all seen, just a glut of news, and it's hard to know what to make of the information that's coming, and also there's a lot of misinformation. Governments are preoccupied. We've seen this in many countries. They're so preoccupied with trying to figure out how to address the situation. It's really hard to get the CSO voice in there and the community perspective. Education is interrupted, as Arthur was talking about. There's a shift to, of everything shifting towards health, and there's obviously more to this crisis than health, and there was a lot of ongoing programming that was not about health, it's critical programming. And then what we see in northern Nigeria and some other places is that in situations that were already very difficult, everything is being terribly amplified with regards to the impact on the communities. And I wonder if anybody has, and you know, there's so many more great comments in here. I suggest that everybody looks at the comments. I'm also keeping copies of all of this, so we'll be able to put it all in a report. Is there any comments that people would like to make at this point?
Thank you, Anne. Okay, I see a raised hand. Annette?
Hi, can you hear me okay?
Yes.
Hi, I'm Annette Scarpita. I work with a local grassroots organization in Congo, DR Congo, and this is a rural area that I serve, and we're focusing on one village. The FOPAC folks have a lot of great connections. The pandemic has not hit the village yet, but they're, you know, we need to get them ready. So over the last few days, they activated their connections with all kinds of folks to be able to make this 8-hour trip. The police, the military, everyone who's, you know, in charge of these roads. Despite a huge flood that took a lot of lives in Uvira, and they were able to go and continue the conversations about community-led development. So there have been some problems with the regional, the cluster chief, as opposed to the ones in the village. So just to sum up, and they brought COVID supplies also, as I said in the chat box. So I thought it was really successful as far as preparing a very local, grassroots, vulnerable community for what is expected to come. Just wanted to lift that up.
Thank you, Annette. That is wonderful to hear. Okay, we have probably time for one more intervention if anybody wants to speak up, and then we are going to move I will tell you about the breakout groups and we will head there. Okay.
I want to say one thing. This is Michelle Inkley from the Millennium Challenge Corporation. On the point about data, both to understand the virus as well as ongoing programmatic needs. I'm really concerned. I know at my agency, we're starting to talk about, and with our partner countries, we're starting to talk about alternative ways to collect data. But of course, they all are based on kind of technology, and then we lose the voice of the most vulnerable because the most vulnerable don't have that technology generally. So this is something I'm really concerned about and would love to hear people's thoughts about.
Thanks, Michelle. And we did actually have a special session around data collection and monitoring and evaluation issues, but definitely this is something that you can go more into in the breakout groups. I know 2 people raised their hands simultaneously. So Daisy, if you can quickly come in, and then we will talk about the breakout groups.
Hello, everyone. Yes, my concern, or what I've noted in the recent past, is that yes, all these issues which are coming out, issues of access, being unable to convene, procurement, they are there and they are real for us. And we are facing those challenges. But what I've also noted within ourselves, we have been given some spaces, especially like in Uganda. But for us to be organized and come up with one voice has, to me, been seen as a challenge. We are here as the community-led development chapters, our members. So where is our collective voice in terms of how we can approach this? Government has been asking, civil society, where are you? Can you help us? Can you do this? We've tried to be part of the task forces, but still it's like sort of patching up. We are trying to come together at this time, and we find we can't stick together because I think somewhere we had some faults or we were not very strong to begin with. So to me, this is an area where I think we need also to look into to see how in the future or in other times we can be able to have be more organized to handle such a situation as one group. Because right now, if one organization goes, then the government is overwhelmed. This organization goes, then another organization, then the other one. So these are some of the challenges, I think, one of the areas which maybe, I don't know whether I saw it coming up, but it is on our part, not necessarily what we are facing, and maybe which would have been easier if we had approached the government as one and say, we want to do this, or this is what we are able to offer.
Thank you, Daisy. And that is actually a wonderful point. So and it was something which we hadn't reflected. I will add that to the sheets. So if you have other suggestions, this is a discussion that can carry on endlessly because we are all facing a lot of challenges, and we will have time to do this in the breakout groups a little bit. Nelly has been creating the breakout groups even as we go through this, and she will launch them soon. But before that, just a few quick pointers. And bear with me as I try and share my screen again. Here we go. So the breakout groups will be exactly 30 minutes. Each of the groups is going to have one facilitator and a note taker. The facilitators have already been given an Excel sheet for the breakout groups to work on. You will come back and each group will report to the main group, 3 minutes. You can decide who does that, but you will be sharing your Excel sheet. I have already pre-populated them with some of the programming challenges that have come. What we are doing in the breakout groups is maybe start with the challenges, but we're really looking at, okay, so what do we need for us, for ourselves, for our staff, for our mobilizers, for our community members? What do we need in order to be able to feel safe to resume our programming? What resources do we have available to do that? What have we learned from the past? And we did see in the polls that 79% of the people here said they have dealt with a similar crisis in the past. So what learnings do we have? And then this is where we go wild. What are some of the ways we can adapt? What ideation can we do? No right or wrong answers, remember. In the groups, remember to record. All the facilitators can record, so please record your sessions. And at the end of 30 minutes, you'll see a 60 seconds countdown, and that's going to then auto-direct you to the main session. So the transition window will pop up and we'll see everybody back here in 30 minutes. So happy ideating. And Nelly, can we launch the groups now?
We can, and everybody just don't worry if you see a little screen pop up on your window for a moment, you'll be automatically redirected. Here we go. Hello.
Hello.
Hi.
Hi.
Hi, everyone.
Hello.
Yep. Hi, are we all here? I think we have a couple more people coming in. Hi, all. Can everybody hear?
Yep. Yes.
Great. Okay, let's get started. So we're in the group that's going to look at the barrier of the ability to convene, how social distancing policies might make it difficult for community meetings, or fears about contagion might make it difficult. that there might not be spaces that's large enough to maintain social distancing while bringing everyone on board. Lots of different ideas. I am going to share my screen with the Excel document in a moment. I also wanted to introduce Chris, who's going to be taking notes for us. And I wanted to see if anyone would volunteer at the start to report back at the end of the 30 minutes. If nobody volunteers, I will assign someone.
I can report back. This is Nanette.
Awesome, thank you so much. And will someone else help keep me accountable to time to make sure that we don't spend 20 minutes on one topic?
I can do that.
Great, thank you so much. Okay, I'm going to share my screen. Can you all see that?
What time do you want me to do the shout outs?
You can give us a halfway notice in about, let's say 14 minutes.
Okay.
And one again when we've got about 5 minutes left. So maybe in about
Thank you, I will.
23 minutes. Thank you very much. So Gunjan has started to take some of the responses from people in the chat and in the discussion and put them into the manifestations. So these are some of the ways in which constraints from COVID-19 are manifesting in the ability of communities and CLD organizations to convene. Before we move on, I just want to make sure, are there any that aren't here? We can go through them. You can all see it, but it says stranger danger, people unwilling to let mobilizers into their homes, mobilizers feeling unsafe in going to houses and interacting with many people, distress, fear, burnout amongst staff, delays in implementation due to lockdown, lack of medical facilities for our program participants, mobilizing groups in rural areas to create committees for CLD project development, lack of global guidance on how to enable safe community mobilization, and specifically what non-pharmaceutical interventions are called for. Are there any other things that weren't raised in the conversation that you think are important manifestations of this?
I'm not sure if this fits under manifestations or not, but I liked what the last person was saying about, you know, damage to reputation, or if people feel abandoned by community-led organizations or by the movement in general. If there's a sense within the government or within communities that people aren't present. Thank you.
Yeah, absolutely.
And if I can quick add one too, Tessa Kaja from Relief International. We're seeing sort of a collapse of many of our feedback channels that are based on convening focus group discussions and what that means for accountability in our programming.
Yeah, absolutely. Can you repeat that? It was collapse of?
For feedback channels or
Thank you.
accountability mechanisms, yeah. Many of which are based on, you know, convening in groups.
Yeah, and I am just speaking from my perspective. I thought the point that was raised about, you know, what happens if we're relying too heavily on technology and only certain people within communities have access to that technology, and what that means in terms of the commitment to making sure that the poorest and most marginalized in communities have their voice heard. That if you're not meeting in person, what does that mean? I don't know if that's something that any of you have been thinking about extensively, but it's a question I've had.
Yes, definitely that's an issue with my work. There is no technology, no connectivity. So as the, if and when I should say, the corona reaches them, these very remote areas, how will they be able to communicate? Right now they can do it with a lot of trouble with the phone. They don't have any, you know, real hospitals that they can turn to, just a local clinic. So that lack of technology especially is really important. And funds, I should say, because I'm not really, I'm not a funder myself.
Yeah, I would like to to add another one as well is,
Mhm.
I don't know if it happens in your countries, but here in Venezuela, complying to social distancing is very difficult because neighborhoods that are working class are overcrowded. So, and their houses also are overcrowded. So they have to either go out, and when they go out, they cannot comply with either the quarantine or social distancing. It's like economic privilege, practically.
Mhm.
Hello. Hello.
Yes, hi, we hear you.
Good, good. Yeah, I just want to add on the issue of challenge in terms of technology. We have some communities where internet is a challenge to communicate using cell phones, and also that becomes a challenge to work using remote in a remote way. For example, in an area where we're implementing the community-led development under THP in Zambia, you find that there are areas which are bordering other countries like Mozambique. The communities are along such borders, and you find that when you talk of communicating using cell phone, they are catching double internet, and also that becomes a challenge to communicate effectively.
Yeah, definitely. To make sure that we as a group are also forward thinking, because I think the challenges are familiar to many of us. What are some of the things that either staff or communities might need, or have you heard they would need in order to feel comfortable returning to work or resuming some of the convening aspects of this work, or to feel safe doing that? Has anyone heard anything from their communities that they work in, or staff saying, I mean, it could be things like, I would be comfortable going so long as I had sufficient protective gear, or rather it would be about having lockdowns. They don't want to go at all, or people don't want to convene at all until the government has changed the directives. Yeah.
Oh, this is Michael Joseph from World Vision US. We've been getting a lot of concerns from our enumerators in Malawi and Zambia that they are not going to go to data collection tests unless there's a vaccine in place, which is impossible for all of us to know when or to comply with their needs.
Thank you. Sorry, I am assigning people to groups as they show up, so apologies.
Maybe a different, coming at this from a different perspective, because I haven't, maybe in our health facilities is where we see people being fearful and concerned because they are dealing with the pandemic on the front lines. But I almost at this point still worry more about staff not taking it seriously enough, or partners not taking it seriously enough and actually continuing to do the same kind of convening practices. We've got nutrition mobilizers in Darfur, for example, who up until recently, I think, are still doing their household consultations, and sort of a fear on our end about how do we ensure compliance with safe convening practices, because it's not necessarily, I don't know that we've gotten to that fear stage everywhere yet. I think many parts of the world don't feel affected by this yet and are continuing business as usual until instructed to or required to do otherwise. I don't know if others that way too.
I would agree with that observation, and I think a lot of our field staff and our teams in the field are sort of concerned and driven by the concern of proper reporting or meeting on reporting needs by different grants or funders, and how that will sort of create a conflict when they get to the point of having to turn in data or having to sort of meet these deadlines, but also figuring out how to best minimize the risk of spreading the virus into the communities that we work. And I think from our end as a sort of global support staff is figuring out what are the procedures or measures that they should be taking now or preparing now for when they do get to the point of being able to travel out into the field. Or if the instruction is that, you know, we shouldn't sort of expect that to happen as soon as we'd like.
Yeah, absolutely. And FYI, I just want to remind that Chris is taking much more detailed notes on everyone, on what everyone is contributing. So if it's not on the Excel sheet, don't worry.
Hi, this is Joseph. I was just going to add maybe something on to what Tessa has said. Tessa mentioned that workers are sort of going about their business as, you know, not taking it seriously. I think even if workers on the front line are taking it seriously, there's a fear that others in your community are not, right? So or you just kind of that it couldn't, it may be staff front line are concerned that everybody maintain safe distances, etc. But I
Sorry, Joseph, it's cutting out a little bit. Maybe to hold the speaker a little closer to your mouth.
Okay, I mean it's.
Sorry about that.
I'm sorry.
Okay, no worries.
Is that okay? Can you hear me now?
Yes, perfect.
Yeah, I'll try to say it very briefly. It's just really, I think maybe the flip side of what Tessa was saying is even when frontline and staff take it, are taking, you know, precautions and are taking things seriously, they're finding themselves interacting with community members who are not.
Yeah.
Communities haven't gotten sort of the message about social distancing. I even going to, you know, when I have to go out to a grocery store or something, I'm still, you know, I'm wearing my mask. I'm being, you know, at a safe distance, but you're seeing a lot of people aren't. So I can imagine for community frontline workers that same fear is there, that not everyone gotten the message.
Yeah, absolutely. And I think one of the things that's coming through in the interventions here is, I think I see Chad also is raising your hand. Chad, why don't you go ahead?
Yeah, sure. I'm Chad. I'm the program director for One Village Partners here in Sierra Leone. And just to talk about the staff being frontline and trying to keep what social distancing means in an environment and a culture where social distancing is not, it's not a concept that's translating very well currently, and it's one that's kind of like antithetical to a lot of traditional interactions with people. We've found that every kind of field activity needs a dialogue where we talk with the staff like, look, here are our basic understanding of how we need to keep you safe. What do you need to feel comfortable doing that? And then we communicate that to the community members that staff is going to be working with. Like, here's what this person needs. Like, we had one of our staff go to field activity going house to house, and we took a moment to say like, okay, we can't go inside your house to complete this survey. We need you to come outside of the house. And that turned into a whole learning discussion with that beneficiary as well, where the staff was able to say, here's what social distancing means. Here's why it's important that you practice this. So I just kind of wanted to give like our own perspective on how we handled that.
Hi, this is Annette. We got the halfway mark coming in right now.
Okay, great. I think in that case, we will move to the next one. But I think I think that was a really great point about, you know, this is different for everyone, and it might have to be taken, you know, at a one by one measures. And I think that's part of the challenge, is one that people may not know themselves what they need to feel comfortable, or they may think it's one thing, but actually that is ever evolving, including as the context change and the situation changes, and also that it's not the same for everyone. And so that makes it difficult perhaps to implement and scale, but also, you know, is very much in line with with the principles of some of the work that we do about listening and being responsive and adaptable.
Can I just add one more thing about what is needed to resume work? I think
absolutely
there are legal and also donor rules about resuming work. I don't know how else to put it.
Great point. Thank you. Yeah.
But laws of the country, etc. Yeah.
Yeah, definitely. Thanks for raising that one. Okay, moving to the next part. In terms of what kinds of resources are available to us as organizations and to communities to enable the work. So this question will focus sort of really on the practicality part, and then we're going to move into what Gunjan was saying was, you know, the wild out of the box thinking. But in terms of resources, this is, you know, this might be the time to sit and understand what different people need and to communicate that. It might be about technology, where it is available within its limitations. It could be about protective equipment. It could be about funding, you know, and maybe that isn't available, but that needs to be available. That would be a key resource. What are some of the resources that you guys have been considering that you have already or that you might need?
If I may start, Nelly.
Yes,
this
please.
is Arthur Nkosi from Malawi. And one of the things that I wanted to share in terms of a resource is that as NGOs, especially here in Malawi, where I'm running the CLD chapter for Malawi, we have seen that there is clearly a lot of funding that has been pushed out to many different organizations, WHO, State Department, UN, World Bank, African Development Bank. And for CLD, I'm talking from a CLD standpoint, is how do we now come together as, you know, CBOs, NGOs, INGOs, and really put forward a case that would then be able to release funds instead of having everybody fighting for those funds, which typically is the case in many different areas. But how do we now come together and actually mobilize those funds to be able to reach out to more community? You know, I don't have that answer yet. We're still trying to figure that out, but that's one thing that has really come to mind, is that there's a lot of money that's been really set aside from many different organizations, and how do we now mobilize together and be able to put forward a proposal that will make sense and reach out to as many people as possible.
Great, thank you, yeah.
Yeah. Hi, I think in Venezuela, sounds sort of like a cliche, but I think it's very true that the most important resource we have is the human resource. We have been doing direct transfers to our community leaders. And I asked one of them how they were reaching the most vulnerable, the ones that don't have access to mobile phones. And he told me that he texted someone in that community who had phone and asked him or her to talk with the people that do not have mobile phones. So the people that live inside the communities find creative ways to solve the problems, and protecting them with emotional support and financially in the ways we can has been essential. Even now we have in Venezuela a gasoline shortage, and volunteers from with bicycles delivered food to the community kitchens. What we have learned is that the people look for ways to solve the problems in their everyday.
Yeah, great point, and important for us to remember that we're thinking of ideas, but some of the best ideas will be coming from actual communities. So please do be sharing what you've been hearing from them. I think Pascal, you were gonna?
Yes, yes. This is Pascal. I'm calling from Benin, the regional coordination for the MCLD in West Africa. I will talk about human resources in terms of youth and women, particularly. And one thing I would add as well is if we talk about how to make sure that communities have a good immunization system, fruits and vegetable traditional one are available. But the issue is that the consumption of those vegetable and fruit are not really like the recommended standard. So there is an issue that we could take also into account. Food, in terms of food supply, but fruit and vegetable particularly.
Yeah.
Nellie, two things. I had a kind of guesstimate when the next 5-minute warning would be. I have 4 minutes left until the 5-minute warning, but maybe it would be 3 minutes. And
Okay.
I would like to say something else.
Yes, please do.
Okay, so I felt like we got really lucky with the project I'm on in that the folks at FOPOC are very well informed, and coupled with the information that I was able to share with them, they were able to really get in shape to be efficient trainers. As far as the funds that people have been talking about, the communities around the work I do have large funders, and no one was getting through last week. So there was no way to get money, nothing. Then the money from the World Bank, the Africa Union started coming in, and now folks at the government level are discussing the logistics of distribution. The estimate for the area that I'm working in is June. And as far as I'm concerned, that is way too late. So what we did was I bit the bullet and I got some money out of my savings, which I don't like, and paid for a trip for them to take. They were able to get access to UNICEF to purchase equipment that is going to be distributed to do this training. So I felt like we hit it really lucky between they're able to get the equipment, and then they were working in unison with the Army, the police, the local authorities every step of the way, like checking in every 30 minutes. So they really, everything was in their favor. So just to respond to the others who are, working on the large scale side, I would suggest that you really get to trusted folks on the ground at the grassroots level and try to work with as many local authorities as possible.
Yeah, thank you. And Arthur, I see that you have your hand raised, and Chad previously did too, so over to you both.
No, that's okay. My hand was raised for the previous question, but that's okay. Let's move forward.
Okay, and Chad, did you?
Yeah, I think it's mostly been already answered a little bit when talking about resources and talking about community leaders finding creative ways to solve the problems. I mean, I think this kind of goes back to the core of what community-led development is all about, really. We found out here in Sierra Leone that it's been way more effective to kind of present the problem to community leaders in such a way that they're like, well, there's got to be something that we can do about it too, and find ways to provide targeted support to those groups of people. And the right kind of ideas, the right kind of resources can really go a lot further when it's coming directly from the community themselves, and traditional leadership infrastructure as well. I think that's often kind of overlooked, but when it comes to this kind of crisis, it's about getting everyone to understand it, first of all, before we talk about government resources. And we found working with traditional authorities and traditional structures has been really helpful out here.
Yes.
30 seconds left for the 5-minute mark, I believe.
I'd like to just say something about information, and accurate, complete information is one resource that's needed to people to get information about the virus, about protecting themselves, about what's happening, but also in lots of different languages.
Yeah.
And for people who are not literate, making sure that this information is accessible to them.
Absolutely. And thank you, Annette. We will move to the last point. And I just wanted to say to Chad's comment, just from my own observation in our own work, which is in Afghanistan, where there's very active, involved CDCs in parts of the country, and some that haven't been quite as active in other parts of the country, but that, precisely as you say, working with the elders and the traditional authorities has been super, super key in all of this. And it's also sometimes a bit of a challenge because they can be some of the most vulnerable because they tend to be the older members of communities. So finding that balance. Okay, so then, oh wow, we have 2 more sections. I failed at my keeping track. So quickly on lessons learned, we were going to just think about some of the ways that people have dealt with this in the past, that their organizations or communities have had to deal with social distancing. We've heard from some people in Sierra Leone about how it was done around Ebola, but also conflict or various kinds of crisis might have meant that people couldn't travel to communities, but we're still trying to find ways to maintain some of the programming that they do. Are there any of these examples that people want to raise? If not, we can just move to the next section.
And just in 1 minute, what we realized during Ebola was basically capacitating the traditional infrastructure that's in the communities you're serving is really important. So spending more time training people how to train others on, at that time it was Ebola, but now it's coronavirus. And then also trying to keep information simple and accessible for everyone, using local illustrations as opposed to, fancy charts or anything like that, trying to make it as basic as possible, but as full in information as possible.
And can I ask a question building on that, but also to anyone else who might have faced this? I mean, in terms of capacitating traditional infrastructures and then sort of relaying the training further, in terms of convening, were then there strategies for how supporting both your councils and local leaders, but also the traditional leaders on how to mobilize within the community if they couldn't meet, at least not in large groups, or whether they didn't need to meet, they could do other things?
In my case, the folks at FOPAC go there both to the traditional leaders at the village cluster level. At the village level, there are actually 2 leaders, and per community-led development, which they're also part of, they created 2 committees, especially for community-led development, and they're both active right now in this. So I think they've got a pretty good thing going. And of course, it hasn't been tested yet for the crisis, but the pieces are in place.
Great. And I think someone had their hand raised.
I did at one point. If maybe I can jump in. Guy Calvert-Lee from World Vision. One of the lessons that we learned previously from the Ebola crisis was the value of working with faith actors and faith leaders in local communities, because a lot of the challenges are related to social norms and customs and even worldviews and values. So if you want people to change their normal practices, then that message often needs to come from someone that they respect and trust, and someone who understands why the kind of the status quo behaviors are as they are. And so if we, for example, behaviors around burying your dead, or even how to greet each other, or welcoming people into your homes, these are very deep-rooted social customs that are hard to change. And so it requires often people of real kind of authority and trust in the community to be able to speak into those issues. And we found that there was quite a lot of success in working with faith actors in West Africa during the Ebola crisis. They were able to bring about that change in behavior that otherwise is quite difficult to achieve.
Mm-hmm. Yeah, absolutely. Guillermo, I see you had your hand raised. And also, if you want to, if you have any thoughts on some of the wild ways that we might adapt our programming, it'd be great to move into that.
Yes, I wanted to add one of the rules that have been found useful to communicate with the communities is that I have perceived that a lot of anxiety relating to showing symptoms of COVID, and maybe some people show fever one day or start coughing and they have a lot of anxiety related. So I told them that something that I heard from a physician here in Venezuela, that people should wait 48 hours before reaching to a doctor if they are showing symptoms, because there is no medical emergency that is going to be deadly within 48 hours. So there's a lot of people in the community who have shown cough or fever, and then before the 48 hours, they stop showing symptoms and they don't need to go to a doctor. So the 48-hour rules has been very useful.
Great, thank you. So on to the wild ideas. Has anyone had any thoughts on ways that one could convene, in actuality or in essence? If there weren't resource constraints, if it was, I'm not, everybody had a sealed body proof act, whatever. I mean, that we're not going to go quite that extreme perhaps, but, so for example, again, in Afghanistan, one of the things that I've heard from someone who couldn't be on the call was, these community development councils, or whatever they may be called in different contexts, have been working for a long time to understand and to represent their community and to engage with the poor or more marginalized members and to come from those groups as well. And so at some point it's about trusting them. And if you can't meet in a large group, maybe you can still have those people meet while maintaining good practice and social distance. Or another idea would be then to meet in neighborhoods. So it can be smaller groups and have people then come together, one representative from each of those, if that's not already how your CDCs are structured. So those are some of the ideas. Do others have any other thoughts on how we might convene or facilitate? And
Sure. Nelly, I can contribute. Again, this is Arthur from Malawi. One of the things that we're doing here and in other countries is working in the communities, especially in the rural communities, is we've taken the idea, and I think most of this is being done elsewhere as well. The distancing, social distancing, you'll find that, if you go into a banking hall, most banks here are still open. People are still going into banking facilities. People have put in signs like stand here. Communities, what volunteers have done is taken just a chalk or a lime and just drawing circles in where they're meeting with community members. Because typically the trend has been, or the tradition has been, we all sit down together very, very close to each other in like a cluster. And now we have to, change the mindset and sit, in a distance. And so education, again, is very key to really understand why are we doing social distance? How do you actually measure social distance, especially in the rural areas? How do you define social distance. I mean, we talk about it, but you know, sometimes you really need to bring it down to the ground level and really explain what social distancing is and why are we doing it. So we've implemented some of those strategies. And when it comes to the education where students can't now be in a big area, and we've broken them down into clusters, students will be, you know, maybe 5 to 6 students who are meeting on a ground, and we draw those circles around so that everybody is at least 2 meters away from each other, and they can still talk to their friends, still learn, and so on. So these are some of the things that we're trying to do within our communities. Whether it's working, we're still yet to see.
Great, thank you. That's really specific and clear.
Just very quickly, during Ebola time here in Sierra Leone, one of the things that when, you know, it's a complex disease and it wasn't easy to understand, and I think in some ways coronavirus is a little bit more difficult to understand. We spent some time talking about how they would define the disease themselves, and there were lots of we were helped out because this was something that was going on in other communities as well. And we're trying that also with coronavirus. Part of what we're hosting these kind of, just like Arthur was saying, these kind of like smaller groups that we would normally work with, who would then work with another small group, who would then network out to another small group. That's the kind of model we're trying out in terms of getting people educated and in terms of doing some kind of basic tracing of who's coming into individual rural communities and who's leaving. We're also trying to get them to talk about, you know, how would you describe social distancing in your own language? And so that would be Mende out here, to get people to think about it in a different kind of way, because it's different than, even to us, it's called social distancing, but it's not really about removing yourself from society. It's more about physical distancing. And so we're trying to, with our coordinators who are working in the local language, we're trying to get people to more actively discuss what it means to distance themselves from other people in their language, and how they can more easily describe that to other people in their culture.
Yeah, absolutely. So guys, the meetings are supposed to end automatically at 30 minutes, but they didn't seem to do that. So we're going to close the meetings. I'm sending a message to everyone, and I'm gonna send us all back into the main room, but thank you guys all so much for sharing.
Can you share so that I can summarize back to the big group? Can you keep this somehow shared, your notes?
Yes, I will post it. I will have it up on the screen when you share. Thanks for noting that. Thanks. Okay.
All right, I see everyone is coming back. I know a lot of people, at least in our session, we had a lot of people who were, who still had ideas and who wanted to speak. So please put in your ideas if you were not able to share that into the chat box so that they are still recorded. But because we are really running behind schedule, despite trying to make this super quick, we are going to start with the groups and ask them to present. So from the first group, who will be presenting? Group 1, you're up. If you could, you have 3 minutes. We will be very strict on time. And I am going to share my screen so that we can all see what you have come up with. And you're welcome to do this in less than 3 minutes if you can, of course. That's always nice.
Okay, well, we had some fascinating discussions. We had folks working in developmental contexts, folks working in conflict, northeast of Nigeria, and people working in Kerala.
John, we lost you.
Hello?
Now we hear you. Yep.
Yes.
Now you hear me. Yeah, I noticed going in and out of these rooms disrupts the sound for a little while. Same going in. Okay, so thank you, Robin, for collecting all this. We had folks from developmental situations, from conflict situations in the Northeast, from where CSOs don't even go, where the safety and access, it was already terrible, and folks in from Kerala, where there's one of the adaptations that they've had for, gosh, 50 years has been an extraordinary network of small neighborhoods.
John, we can't hear you again.
Is that true?
Now you're back.
Yeah.
Back, huh? Well, anyway, I don't know why my internet is flaky, but the point is, one of the big things that was mentioned was having neighborhoods that are well organized, small neighborhood groups that are connected to the local governance system, so that everyone knows who are the neediest and that any relief that's available can truly reach the neediest. That kind of access is afforded by that kind of level of neighborhood coordination. And so there are other adaptations. Radio in the conflict areas has already proven extraordinarily useful in warning people about where Boko Haram is, and is now also very, very useful for getting out messages. We also spoke about access to hand washing, because people depend on pumps, hand pumps, and that's going to have a handle touched by 150 people a day. So making sure there's a tippy tap or some hand washing station. And the promise was made to send everyone information about how to construct zero cost tippy taps.
Great. Thank you, John. That was very efficient. From the second group on convening and how this is creating a barrier to that, I believe we have Nanette who will be reporting back to everyone. Yep, and Gunjan will just put that
a little bigger. Yeah, thanks. So we spent a good bit of time talking about the manifestations. Some of them came from the discussion that we had in the bigger group before we broke out into small groups, and then we've added some here as well, talking about how all the barriers that people are the ways that the people are not able to convene. We also talked about some data collection issues, people not being able to go out, and feedback mechanisms. I think that was on this manifestations. If you can scroll down, what's it going to take to get people to be able to go back to work as normal, or somewhat a new normal? Different people are going to have different needs. We need to recognize that, and that there's already some concerns that some people are being too cavalier, etc. And then in terms of the resources available, we talked a lot about funding and human resources available to be able to convene, and but we also need to have information in lots of different languages, and for people who can't read, information available to them. So those are some of the resources that are going to be needed to come back to convening again. We had several people on the group that had experience with Ebola, and they talked about some of the lessons learned from that. Creating committees, smaller committees, having people, small groups of people who are appropriately distanced. We talked about physical distancing rather than social distancing. People being able to still convene, but in different ways. And I've lost my, there we go. I think that's us again. Yes, we are back. Really throughout several of these categories, the importance of engaging with traditional leaders, with faith leaders, and having them involved. We ran out of time a little bit when we were brainstorming, but but we have many more ideas about that. And so having, and I skipped one that I thought was really important about Ebola, having people define the disease themselves. So coming up with locally understandable explanations of the disease that's not necessarily related directly to convening, but I thought it was a very helpful lessons learned. Thank you.
Thank you, Nanette. And just to be sure, John, I didn't cut you off. You were under 3 minutes if there's anything more from your group you wanted to say.
Just there was a spirit point that was made, and that was that we should all stop using the phrase social distancing and use physical distancing. And a similar thing was said to me yesterday, that we stand for social solidarity in the face of physical distancing.
That's a great point and resonates, I think, probably with all of us. I've heard also lots of issue with the term social distancing. So thank you, John and Nanette. Now from the third group on the barriers around procurement and service delivery. Who will speak from that group?
Anne will be speaking for us. Anne?
Okay, so there's resonance themes across the groups. I think something that really surfaced in this group is that it's a nexus of the point of view of the perspective of programs and projects and program managers and project managers, and the perspective of communities. And those two things are often quite well synchronized in the first place. So if you look at it from either side, there are similar issues. One very important issue, obviously, from a service delivery point of view, is the idea of community mobilization. And from a program perspective, we know how to do community mobilization, but this presents some special challenges. One is the idea of PPE for the community mobilizers, protecting them. The second is even just starting with the PPE, you've got stigma issues as you're trying to raise awareness around what is COVID and why do you need PPE, and that it's highly contextually sensitive with regards to helping local people understand it, including the ideas of indigenous language and the local circumstances that would affect the issue. So that's the community mobilization piece. Another piece that came up a bit was the idea of the issue of cash flow and income. So there is, from a procurement, say, point of view, there's the idea of cash transfers, but if mobilization is reduced, there's not ATMs around and things are happening on cards, that can be an issue. And then the other part of the cash flow issue is the income that gets interrupted with the communities that we're trying to deliver services to, many of which have to do with entrepreneurship. So that then intersects with the idea of food availability. So in programs that are trying to provide services or support around nutrition and food security and agriculture, you've got issues of farming and getting access to the farm stuff when you need it to do the different elements of farming, the selling of the farm goods, the transportation of them, and the buying of them, all affected by COVID. And so that again ties back to cash flow and income. And then one other big piece that came up is the use of technology within the context of all of this. So we've got the need to, there's the ideas of local radio, supplying phones, doing online training and facilitation, helping online work. Somebody mentioned the idea that they're using local Wi-Fi clouds and to use local language video. So again, all of those things come from the nexus of programs and communities. The final thing I'll say is that practical solutions come up very efficiently and effectively when you're looking at things from these very community-based perspectives. And we heard so many on the phone, and the idea is that there is the capacity of programs and communities to figure out how to address all these issues if we can get them together from the point of view of that. So we listed a lot of these out in more detail in the spreadsheet from the resources available, lessons learned, and brainstorming ideas that is available for people who want to look at it in further detail.
Great, thank you, Anne. And I just want to say, so we said until 12, so if people have to hop off, that's fine. The Zoom will keep going for a little while longer. And we just want to make sure we hear from the last group and then get on to next steps. So if you have to head out, totally understand. And again, we'll be sharing all the notes, but if you're able to stay with us for a few more minutes, that's great. So the fourth group was on people's time and shifting priorities as a barrier.
Hi, this is Holta. Unfortunately, we weren't able to finish all the questions, but as we spend most of our time discussing on some of the manifestations that we see, and in addition to a few of those manifestations that were already mentioned in the larger group, what we see and what was a worry among our group, it's that we see that activities and programs are moving from multi-sectorial and holistic approaches of development to just being focused on COVID. And sometimes this is, we are risking the losing of the gains that we have made in other sectors as this shifting of priorities of where the funding and our energy is going, rather than seeing matters interconnected. Another overarching theme of our discussions was the general fear that it perpetuates not only the communities, but the communities and ourselves, this uncertainty about the future, that it's actually causing a lot of the paralysis and also causing some of the shifts that we are seeing. And that's something that needs to be addressed head on if we want to see that this shifting of priorities and what we are currently experiencing actually has it's addressed adequately. Another one of the manifestations, it's the lack of representation. First, it's a lack of representation when it comes to civil society groups, but then also when you drill down, it's a we are seeing that in a lot of the groups and task force that are being formed, there is a lack of female representation across the committees and at all levels. So these are some of the agendas that the civil societies were pushing, civil society organizations were pushing, but that seems to be like a second thought nowadays. Then there is a lot more that you can read through the spreadsheet. When we looked at what needs to be done, in a way jokingly, but not jokingly, we said a vaccine, something that helps us all move forward. But more, what you will see, what we listed as part of what's needed to feel safe and resume, it's a lot of these are also dealing with like more of like accepting some of this will be normal reality. So maybe the online researches and sharing of best practices, it's not only something that it's for a time like this, but it's something that we should harness for a longer time. The revamping and organizing of these approaches of single agency level, multi-agency collaborations to figure out how to come up with one with a more and stronger voice. A lot of the people that were in the group felt that this was a good start even for the movement for community-led development to amplify that voice. Can we go slow down, and I'll just take seriously less than 30 seconds. On the lessons learned. There are, similarly to the other groups, we focused on what did we learn from other outbreaks and other conflict situations. And one of the things that came up, it's like, even when it comes to stigmatization, we know that that it's not the same thing as with HIV/AIDS, but there are some things that work for HIV/AIDS and how groups were mobilized that we could still use nowadays for COVID, especially in areas where COVID is being projected on a given population or ethnicity or religious group. And then a lot of the things that we already shared, like the localization of materials, using of pictorials, keeping in mind that we're not, that we have to deal with, we have to cater for those that are most vulnerable and how the information can be passed on to them. So that's why you have a lot of materials in local languages, pictures, diagrams, things that people can quickly grasp the message and move on. This is more about the prevention. And then documentation of recent and past interventions. This was a good call because we are not thinking far ahead, but the things that we're experiencing right now and how we're reacting, documenting all of this could serve us so well in the future. Hopefully this is going to be one of a kind pandemic, but there are a lot of situations that we can transfer what we are learning from here.
Thank
and
you, Holt. Oh.
A lot of these things weave in from one group to another. They're not they don't perfectly fit in one category.
Thank you, Holta. And I'm going to pass to Gunjan in just a second, but if anybody has other ideas, thoughts on any of these questions that they discussed in their groups or reactions to what has been presented from the other groups, please note it in the chat box and we will make sure that that's all documented and collected. And I'll pass over to Gunjan, but we can also leave the Zoom up for a few minutes after we finish so that people can continue to add anything into the chat if useful. Over to you, Gunjan, on next steps.
Thank you, Nelly. We definitely, I know there is a lot that has come out on chat. There's a lot we've discussed in our group, and there's a room for a lot more discussion. But we are short on time, so we want to quickly do this. And then, like Nelly said, we'll wait so that people who want to continue the discussion or want to put in points are still able to do that. So a lot of what we heard, and I'm hearing across different groups, is really that the movement is a platform for collective action. And CLD is all about adaptation and being adaptive or transformational development, right? So it is really a question of how much are we willing and able to do at this point to resolve and take this forward. And there are different ways we can do this. I'm sure people are putting in ideas. If you have ideas, put them in the chat box, and we will quickly have Anne come in at the end of this to bring in some of the main steps, key ideas on the next steps at least before we end the meeting. But we could do working groups to maybe, unpack a couple of issues which have emerged or a couple of ideas which have emerged. We could do a follow-up call looking at one particular issue or area. There are a zillion things that we can think of and do. We know countries are already working on this. So the Zambia chapter of the movement has already created a task force on COVID response. And if you want to know more about it, then please speak to Anne, and please put in your email ID into the chat box for people to get in touch with you about that. Nelly mentioned at the beginning, we are already compiling a list of what are some of the COVID-related innovations. But on this aspect, on programming, one of the things that we will do is at the end of, after today's meeting, give us a few days, but we will compile everything that's come up. We will group them because we didn't have the time to do that today. So we will group them, put them into different categories, barriers, see how they cross-link, and send some of the things that have emerged, because there have been a lot of good ideas that have emerged in terms of solutions also, and ideas which people are practically doing. And then there was a lot of synergy around the need to come together. So we will, alongside the minutes, the recording, and all these solutions and ideas that you shared, we will alongside that share a quick short poll and ask people who would want to continue to work on some of these areas. So this is about collective action, which requires collective input as well. So please respond to it. So before I go to Anne to ask her to summarize some of the ideas, if people have identified those in the next steps, John, I also want to come to you very quickly in 30 to 60 seconds. If you can, having been through, been on this call and looked at it, from the movement secretariat, what are some of the things that you think we can do to support some of the things that people and partners have been asking for. So John.
Do we still have you, John?
I'm here. Can you hear me?
Yes, now we can.
Okay. So I want to thank everyone on behalf of all of the movement that isn't here, and particularly to all of the people who haven't really been part of the movement. So I just want to urge everyone to please go to mcld.org, Movement for Community-Led Development.org. Go under About Us and subscribe so that you get our updates. And also there's, as you'll see, there's a huge section where we've done a big listing of resources and approaches from all different sectors for community-led response to COVID-19. This call and a lot of the elements of it will be extremely valuable, and we'll try to reference it all there so that that should be a resource to everyone. So that's one thing that we can do. And then we have our global call on with Mercy Corps 1 week from tomorrow, and everyone who's subscribed will get a reminder of it. And they are going to be talking about really this issue of measuring social capital. And so that should be really interesting. I know questions came up during this call on measurement. And certainly a lot of comments came up on building social capital. So thank you again, and I'll pass it over to Anne.
Yeah, and if you could quickly share, especially if there have been any ideas around the next steps, has there been any interest in convening or what those are, and then maybe summarize in a minute if there are any very key ideas that came up in the discussion that we missed out on. Thank you.
Well, there's a lot of interest in the spreadsheets, both getting access to them and adding to them. So that's one thing that we can do, share those along with the notes that we put together. Also, I think, you know, there's just a lot of interest in, oh, somebody does mention knowing and recognizing CLD members who have been infected in the line of duty and sharing their stories in order to encourage us. It's a really touching idea. We did have a Hunger Project person in New York who was down for 3 weeks, and she's all better now and feeling great, but it was no picnic. So I think it is one of the important things to help people believe it's real is when you know someone or you know someone who knows someone who has been infected with COVID. Diana also recommends follow-up groups based on the moments that we identified today, and maybe they'll change or adapt. So it does seem like there's a lot of material covered here, and breaking up into groups that could follow up would be important. I want to add from the perspective, just very quickly, of the national chapters. We have national chapters in many countries, and the countries we don't have national chapters in, we have people who are forming national chapters, including Dr. Rebecca and others on this call. One thing we've really seen from the national chapter level and the regional level in Africa is there's two very big needs: to figure out how to coordinate and collaborate at the national level, so we could have that voice that Daisy talked about, and we can synergize and learn across the national level, and also speak on behalf of grassroots organizations and communities at the national level. That's a huge gap, and it really needs to be there. So we have a lot of ideas about moving that forward. If you want to know more about that, let me know. And then the second thing is, as everyone on this call is probably working in some way with programs at some level connected to actual programs that are running, and there's just urgent needs to figure out how to pivot to COVID, how to support the programs that are underway, and a lot of ability to learn so many great ideas and so much good cross-peer learning opportunities here. So those are a couple of the levels, and then this is a little bit more of a global level, and again, obviously a big demand for keeping this conversation going. Let me stop there and turn it back over to you, Gunjan, to see what you would like to say in conclusion.
Also, sorry, this is Nellie, just going to jump in really quick to make a plug for, I know over the course of this call, even though we were talking about how to maintain our regular CLD processes, a lot of the innovations and actions that communities and CLD organizations are doing in response immediately to COVID came up. So a plug again to input those into the Google document that we shared a link to at the beginning, and I'm sure we will share that around again with the follow-up information from this call. And thanks to everyone for their extremely active participation in this call. Gunjan, over to you.
I just wanted to share what Nelly was talking about. If you go to the MCLD website, you go to Share Innovations, and you will see this, and you will come across this Google form, very simple, where you can share some of your COVID-related work. Thank you for the participation, for all the great ideas that we've seen today. I know there was a lot more that could be said. I know there was a lot more that people wanted to say, and we were not able to bring that in. We will leave the Zoom open, like Nelly said, for a little while. So put in anything that you need to on the chat box. We promise we will get back to you on anything that you have put in there. We have some great ideas about the next steps now. We will definitely share the spreadsheets, make them open access, so that people can work collectively on developing them and those ideas. We will share a report, some of the key findings that have been coming out of this. We will be sharing what's coming out in the innovations database. And we will be sharing, like I said, a poll or a call to action, asking people who would like to work on specific ideas or issues in specific working groups, just to deal with particular aspects of the programming. And then, of course, we have the national chapters. Please connect to Anne if you want to work at the national level, come together and coordinate action. There is great work happening there. So thank you, everyone, for your participation, for being there, for being so active. And yes, we are here. The movement is here. It is a platform for collective action. Whether you are part of it or you are a newcomer, you're very welcome to join us. You're very welcome to learn more about us, and you're very welcome to reach out to any of us. In fact, and if you could also in the chat box, type in John, your, and my email IDs, so that if people want to get in touch, they can just drop us an email or from the MCLD workshop. So thank you, everyone. I hope you got some of what you were hoping to get from today's meeting. I know I got a lot more than I was hoping to get from today's meeting, so at least I am really, really happy. But now, even as we put in what we want to put into our chat windows, any messages, if people want to, as they say, bye, say whether they are happy, whether they got what they wanted from here, please feel free to unmute and do so. Thank you. And thank you, everyone who helped run this, the facilitators and the note takers, everybody who's been working behind the scenes. Thank you.
Thank you.
Everybody.
Bye-bye.
Thank you.
Bye.
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 Bye, everyone.
Thank you. Bye.
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 Bye.